Hi, everyone. Thanks so much for joining us. Always wonderful to have you here. This podcast is geared toward you, the consumer, who might want to understand more about different treatment options available to you if you decide you want to get help for anxiety, depression, addiction, an eating disorder, whatever it is that's going on for you, or sometimes people just want some help thinking through their life. Today, though, we are going to talk to a guest whom I really adore, and I adore most of my guests, but this is one I know personally. We're going to talk about ketamine-assisted psychotherapy today, and I'm going to let our fabulous guest tell you all about it. But before that, let me tell you all about her. This is Clara Langrall. She happens to work for us, and I really adore her. She's a lovely human. Clara earned her Master of Social Work from the University of Illinois at Chicago and completed ketamine-assisted psychotherapy training, or CAP, K-A-P, through All Community Therapy Center. She provides individual and couples therapy as well as CAP at the Juniper Center. Clara's approach is humanistic, relational, and holistic, and she's just a lovely human, folks. So I'm thrilled to have this time to be able to just sit with you and talk, but I'm also thrilled to hear what you have to say about ketamine-assisted psychotherapy. So welcome, Clara Langrall, and thank you for being here.
Hi, Margo. Thank you so much for that really welcoming and warm introduction. I'm happy to be here too. Ask away.
All right, great. Thank you. Right. Yeah. Like having your boss say, come on my podcast and let me ask you a bunch of questions. You know, I'm such a bossy boss there.
I adore working here and I adore you too. I just didn't want to do too much taking up time on the air of like just us smiling at each other, but it is a pleasure. It is.
Fair. That's fair.
And I'm really happy to talk about
it. Glad.
Mm-hmm.
I'm glad. Well, that's great. It's that I think is beginning to gain more notoriety. And I would love for people to understand what it looks like. How does it work? What does it mean? What are the steps to get there? Will insurance pay for it? What might a session look like? I mean, all of those things that help people, for me at least, if I was going to do any kind of therapy, I'd want to know what it was like. So for those who may not be familiar with ketamine-assisted psychotherapy, what exactly is it? And, of course, everybody wants to know, how does it work?
Okay, here's how it works. So it combines regular talk therapy and ketamine medicine. So ketamine is a safe, well-researched medication with over 150 applications according to the World Health Organization. And it's used in this context to help people access deeper states emotionally, increase self-awareness. It actually promotes neuroplasticity in the brain. So that's the brain's ability to make new connections. And it can make it easier for someone to break out of stuck patterns of thinking and feeling. What's really interesting, it can lower your usual psychological defenses, help you shift your perspective. It can lead to breakthrough insights. But the key to making those insights meaningful is what we call integration. And that is just a fancy way of saying talk therapy. So that's the talk therapy that happens the next day within that critical 24 to 48 hour period, although it's not the end of the world if it happens a little later, but we try to get it in real quick after the medicine sessions so that people can process and understand whatever came up during their medicine sessions, and they can apply it to their life and their healing.
Oh, wonderful. Okay. All right. So you used a lot of really good, important language in there. You used the term neuroplasticity and medicine sessions. So why don't we talk a little bit about, if you don't mind addressing what neuroplasticity, just what's a definition of that, and then maybe a little bit about what does that journey look like if somebody's going to do ketamine-assisted psychotherapy?
So brain cell growth. We used to think that you only had a certain amount of brain cells. I don't know if you remember that myth.
Oh yeah, and once they died, they were gone, and your brain was slowly shrinking. Yeah, right. Mm-hmm.
Exactly. And some good news for the day. That's not the case. And in fact, certain things like ketamine, like psychedelics, can increase your ability to generate brain growth. Did that answer your question?
It did, yeah. So neuroplasticity just means your brain can change. And this is a way
Yeah.
that your brain can change. Now, it's not going to change in a way that you don't consent, but it might help your brain process things differently, think about things differently, maybe feel differently about some things that you weren't able to prior to the treatment, which is really what all of psychotherapy is about, but especially a
Yeah.
specific intervention like ketamine-assisted psychotherapy. So can you talk a little bit about your professional journey and how it led you to working with CAP? Like you said, you had been at the practice for a while and this had been a career goal. How'd you get
Mhm.
interested in this?
Yeah. So for me, it was a very natural evolution from my interest, my path as a social worker and a therapist coming from a harm reduction and social justice lens, a core belief in the biopsychosocial model, this approach that, there's power in the mind body connection. I've always been interested in how people can reconnect with themselves in ways that feel empowering, especially in a world that so often disconnects us from our bodies, from our emotions, from our minds, from our inner truth. I definitely was drawn in also by the stories, people facing death with less fear or healing trauma by accessing something deeper, really powerful stories. But there is a lot of hype, so I don't want to go too far into that, but that was what attracted me initially was, just the same thing that attracts everyone is hearing these really profound stories.
Exactly. That makes sense, Clara, right? So you heard that it was effective for people in a
Yep,
way that maybe a typical just sitting and talking to a therapist might not be. And you were drawn to that.
exactly. There's the potential for people to break free from limiting beliefs, different kinds of conditioning, etc. So with CAP, I see that as a way to bring in a grounded therapy container, one that honors both safety and sovereignty. And yeah, for me, it's about supporting people reconnecting with their own wisdom, their own agency, sometimes even their own sense of the sacred or other types of important meaning making.
I love that. Right. And I think it's a category of psychedelic assisted psychotherapy, and there's ayahuasca, there's, some people are doing just other forms, but this is one that is now legal and sanctioned. And so,
Yeah,
as you talk about the spiritual journey, folks I know who have gone through CAP have said it can feel very much like it taps into something spiritual. And other folks have said, nope, it just helped me get through my trauma. So people have different kinds of experiences.
absolutely. Yeah, that's in no way like a prerequisite or even part of the process for people sometimes. Yeah.
But it can be a meaningful part of it. So there's been a lot of talk. As you said, there's been some hype. We know
Hmm.
that ketamine has been used in medical settings. It's used as an anesthetic when people are having surgery. That was one of the medical usages. We've also heard about other people having not great outcomes from using it recreationally, like Matthew Perry, who perished after using ketamine, and I think he drowned in his hot tub. With all due respect, folks, to you know, but he was using it off label and not legally.
In a
So,
totally different way than we use it.
in a
Really
totally
not even comparable, really. Yeah. I
great,
mean,
yeah,
we're talking about the difference between street drugs and prescribed medication, first of all, and then also monitored dosing with supportive practitioners around you, really monitoring your safety emotionally and physically. And also the dose range that we're talking about, and I'm not a prescriber, so I'm a little bit out of my lane, but the dose range that we use for ketamine assisted therapy is nowhere near even anesthetic, much less like overdose range.
that's really helpful, Claire. I have heard from some folks that they're a little nervous about ketamine because they knew it was used in surgeries and they were
Yep.
wondering how out will they be, and they don't want to be completely out. And people who are worried that they're, going to have an outcome like Matthew Perry. None of that is what we're doing. That's not ketamine assisted psychotherapy. Those are two completely different uses. I love what you said about, one is a medical intervention really for surgery, and the other one is a street drug. I mean, that's used as a street drug. That's not the same thing. So, can you walk us through what does a typical ketamine assisted psychotherapy treatment, because it's a treatment, it's not a single session. What
That's
does
right.
that look like? And what would a session look like a integration session or a medicine session?
Yes, great question. There's a lot of different like protocols out there. The way we do it is we recommend a baseline of 3 medicine sessions because there's good research to show that's like a minimum for optimal kind of outcomes. We can go higher up. Many people choosing to do 6 or 8 is very dependent. But so those are the actual medicine sessions, what we call medicine sessions, using the ketamine medicine. And then before that, before we even do any of that, we have what's called preparation sessions. And so we have 3 of those, and that's much more similar to just like talk therapy, except that we're also talking a lot about what to expect with CAP treatment, with the ketamine experience, with the medicine. So prep involves us getting to know each other, setting your intentions. That is, what are we, going inward? What are we looking for? What are we searching for? We can't control the journey, but we can cultivate a sort of like awareness in the background of like what it is that our intention is. We say intention without expectation. And then, yeah, we talk about all sorts of things, preferred grounding skills, creating a sense of safety, all that kind of stuff. So then on session day, medicine session day, we set up a calm, supportive environment. We check in for about half an hour. How's your mood? Has your intention changed? Are you still consenting to do this today? Should we move it to a different, whatever. Then we get comfy and cozy. There's a fold-out futon. I encourage people to arrange the pillows however you want. Volume check with the headphones, any kind of like blankets available. We have a weighted blanket. We review your intentions, preferred grounding techniques, and then whenever you're ready, the ketamine is administered. So we have 2 different routes of administration. It's either going to be self-administered by the patient, by the client, whatever your terminology is. I like client. But yeah, so you'll self-administer the lozenge. So that's the under the tongue version, which is like a swish and spit method. It can be a little bit cumbersome and taste a little bit bad. Or there's like the faster injectable IV or intramuscular version, which would involve the nurse practitioner administering it. And then the client enters this inward expanded state for about 45 minutes. I encourage them to go inward with the eye mask on, but if you feel compelled to come out for any reason, either want to say something, do some breathing exercises together, ask me to take a note, or simply just see that I'm there supporting you, I'm there for that. I'm in the space the entire time. My role is to really just be a safe container, not direct the journey in any way. I try not to, contaminate with too much input. After the experience, we try to avoid interpretation or analysis. We really just focus on staying present with whatever content has arisen, gently reconnecting back into the awake state. As this process happens, I tell people I'm going to be your scribe, right? So I journal, I write down as much as I'm able to capture about, in your words, what happened just now, what was the experience? And a lot of times it's seemingly nonsensical, and that's totally normal and fine and good. And then I type up those notes later, email them to you with the Spotify playlist. Listening to the music can help to kind of like re-trigger, reconnect to that felt emotional state. And then the real magic happens in integration the next day, where we explore what came up. How is this related to your intention? How can we use what we've learned to support healing and change? So it's about the medicine, but it's also about the process that surrounds it.
That it actually sounds like a lovely process. It sounds gentle, right? I mean, so you're there really to be supportive. If there's something they need, you might take a note. You'll certainly be the scribe at the end, but you might assist them with breathing if they need to, or hold a hand if somebody asks you to. I mean, you're there in a supportive role. That's the therapist's job. If they're taking something sublingually, under the tongue, then there's no nurse practitioner involved or a medical professional. But if they're doing anything that is involving a needle, then we do have a nurse practitioner who will administer that. They're a licensed professional. They know what they're doing. And it's usually either an IV or we use intramuscular. They'll give you a shot in the arm and that's it. And the medicine lasts about 45 minutes. And you're there just to help ensure comfort, safety, and to be a resource if somebody needs it. It sounds like kind of a lovely process. And the client's job then, they're there to rest and to go inward. They're not necessarily having to talk while it's happening. They can if they want to, but it's to go inward and to explore and to observe what occurs
Yeah.
while the medicine is in their system and those neural changes are occurring. Yeah. Okay.
I love that word,
Wonderful.
observe. Yeah.
Yeah, they're kind of an observer of the process. I do EMDR, folks, which is eye movement desensitization and reprocessing, which is a more active process, but similar in that we are observing as opposed to trying to make something happen. So you kind of get to rest into it.
That's right.
Great.
And that's deceptive for people. I think people get really stuck on like, what am I supposed to be doing? And it's like being present, observing, going inward. And you know what? That is really hard to do, actually. We're not encouraged to do that in life. So people really struggle. It's simple, but super hard. But that is your job as a client, is to go inward.
Right. It's simple, but not always easy. Those aren't the same.
Those are not the same thing.
Right. In EMDR training, they talk about how, and this is sometimes the visual I'll help people set up for themselves. If you sit on a train and you're looking out the window, before you're going so fast that everything's going by at a blur, but you're just kind of looking out the window, kind of watching what's going by. I'm observing. I'm not making it go by. I don't have to get up and start driving the train. I just get to sit there and watch what's happening. I'm observing. So perhaps that's not a great analogy with CAP.
No, that's a fantastic analogy. Yeah.
Right. So what advice would you give someone who's curious or hesitant, either or both, about exploring CAP? What advice would you give them?
I think that that's a good and reasonable question, except that there is no there are no two experiences that are the same when it comes to psychedelics. So there's nothing like that at all that we can really even conceptualize. And as a matter of fact, it does a disservice to that process of being there, being present with yourself. If you are hoping or forcing or wishing or avoiding or whatever. So it is critically important to understand this piece, that experiences can vary widely. So some people feel calm and relaxed. Others might have vivid imagery, emotional release, memories, body sensations, twitching, shaking, in some cases, vomiting, or just a general sense of an expanded awareness. It can be introspective, ecstatic, underwhelming, or disorienting. It's really just all totally up to the universe, and it's part of your unique journey. So I really want to encourage people not to focus on the idea of having a right experience or doing this the right way. I know that can feel really unsatisfying as an answer, but that's the reality. These experiences cannot be predicted, and it's important that you know that all of your experiences are exactly as they should be. So
can't fail an EMDR session, a CAP session. You're not going to, it's not a pass fail. You're not going to fail at it. And it sounds like the things like vomiting aren't as common, but just to understand that the body is going to do what it's going to do.
Yeah.
Most of the time, it sounds like there's release of some kind. Sometimes people sometimes cry.
Yeah, that's much more common.
That's much more common, right? It happens. It's your brain and body working through something. And so, Clara, this is a great point, I think, to ask what kinds of life experiences or issues or conditions would lend themselves to ketamine-assisted psychotherapy. And if somebody's curious, it sounds like it might just be a good idea for them to make a phone call or do a little research online or, connect with someone like you who can answer questions for them and say, am I really appropriate? It's not necessarily the kind of thing that you sign up for and you show up and you do, right? There is a screening process to make sure that this would be a treatment that would be helpful or could be helpful for them. I mean, nothing ever is 100%, but is that accurate?
Well, that's right. Yeah, I mean, expectation management is huge, especially considering the hype that we were talking about. And then a lot of people internalize ideas that they're like, need to fix themselves or something like that. And ketamine is going to do that. And that's not the case. You are not a problem that needs to be fixed. And even if you were, ketamine wouldn't fix you.
Right? Well, right, exactly. Right. I mean, nothing works that way. I wish
Nothing
it
really
did.
works that way, or we'd be millionaires.
Right, exactly. That's right. If I had that in my pocket, boy, I wouldn't have been practicing for 30 some years. I would have waved that one. So managing expectations and knowing that, yes, it's worth a phone call. It's worth asking. And I've had some folks who have had some real benefit from this. They've done traditional psychotherapy, talk therapy, and for some folks, and this is not unusual, if you've read something called The Body Keeps the Score by Bessel van der Kolk, there are certain ways in which talk therapy can be exceptionally helpful. It's what I've done for 30 some years. And I got trained in EMDR, and we have a ketamine assisted psychotherapy program because sometimes people need something in addition, and they'll go do a piece of work and come back, and we'll do more processing and talking about what came up. But it moves the needle in a way that talk alone can't, because talk therapy will access certain parts of the brain. These interventions access different parts of the brain. So I think we kind of have to think of it that way. So talk therapy is great. Keep doing it if you're doing it, but you might want to consider getting a little bit more information. So what advice would you give someone? I'm saying call and ask a question, easy for me to say, but what advice would you give to someone curious, yeah,
Yeah.
or hesitant about CAP?
Yeah, it's an interesting question. It depends on the hesitancy, right? I think in general, it's important in life to strike a balance between exploration and safety, activity and rest. It's a balance. So if you're curious about like efficacy, there's a ton of research about the safety and efficacy. You could even just Google like whatever it is that you're trying to work with and ketamine to like see if it's supported by the research and, to what extent. And then also it can help to build your support system before embarking on the process. So, whether that means friends, loved ones, even like if you have a long-term therapist that you have a really good relationship with, I can consult with them beforehand, or whoever your CAP practitioner is, you can ask them to consult with them, talk about how to support you, anything else that's going to make you feel safe and supported during the process. But like for me, really with any therapy, it's about the quality of the connection to your therapist, your CAP therapist. So we know from the research that is critically important across all interventions, all styles of therapy. That is like critically important is your bond, your human to human bond with your therapist. So that's certainly the case, even more so, I'd say, with expanded and vulnerable state of consciousness. So like really just trust your gut when picking a therapist and speak up.
This
Hey,
can really jumpstart their treatment and get them a lot further. It's like somebody put you on the bus on the racetrack and took you, 10 yards from the finish line or something. It just can expedite the process. So it can definitely be worth it. So Clara, just one final question for you. What's one piece of advice in general that you would offer someone considering this therapy for themselves or for somebody that they love? Because as we know, sometimes I'll hear something and I'll talk to somebody I love and say, heard about this great thing. I'd love for you to hear about it too. So what's one piece of advice you would give? Or more?
yeah. So I would offer, come to this therapy with curiosity, not just urgency. It can be a powerful catalyst, but it is not a magic fix. It works best when it's paired with genuine therapeutic intention and integration. If you or a loved one are considering this therapy, take time to understand the process, ask questions, make sure it's being offered in a safe, supportive, and ethically grounded setting. The most meaningful outcomes really do happen when there's a strong relationship with the provider and when the person feels empowered, not pressured, to explore their inner world at their own pace.
I love that. And you know what, Claire, because there are some places, and not to disparage any treatment offering, but there are places where there will just be some chairs lined up and people will get an eye mask and they'll get an infusion of ketamine. And that's kind of it. There's no assisted psychotherapy. It's just ketamine administration.
Okay.
So, right? It's just K. It's not CAP. It's not KAP. It's just K. That's great. It's just K. But CAP is a different animal because you do have that human element. There is a therapist there to help with safety and support. And boy, if you can have a nice rapport with that person and can feel good and comfortable with them, it sounds like that can make a big difference in the experience.
Yeah, I mean, that's what it's all about. It's, I think, really like undervalued in our society. But again, like time and time again, the research has shown that like good therapeutic outcomes are totally based on just that interpersonal connection.
Yep, over and over and over again, folks. That's true. Clara
Mhm.
Langrall, thank you so much for being here with us today, folks. I told you she's lovely and delightful. I think you just got a taste of that too. So, Clara, if
Thank you
someone
so much,
wants to
Margo.
connect, it's my pleasure. If someone wants to connect with you, how would they find you? And folks, we'll have this in the show notes, but what's the best way for people to find you?
Call the Juniper Center. Yeah, you
Okay.
can just look at Clara Langrall. It'll bring you right to our page, and you can schedule a consultation with me, or contact our intake team, and they'll put you on my schedule.
Wonderful, wonderful. Well, folks, if you have any questions, please do contact Clara. If you need to get a hold of me for any reason or would like to ask me questions, you can reach me at thejunipercenter.com. That's our website. Feel free to reach out. We also like to help people find the best treatments for them. This is definitely one of them, but we would point you in another direction if it's not with us. So, Clara, thank you so much for being here. Those of you listening, thank you so much for joining us. We hope to have you with us again next time. Be well.